Okay, hi, Assalamualaikum warahmatullahi wabarakatuh. Okay, so we are from Group 40. Today, we want present about patient workflow and patient management process in radiology department. Okay, so next. Okay, so before that, I will introduce you our team members, which is the first one is me, Cikgu Syazah Marlisa binti Cikgu Ahmad Rizal. Okay, next, Nur Adriana binti Rosmadi. Okay, so next Nur Sakinah Muhammad Razali. Okay, next Dahlia Azariah binti Fatah Rahman. Okay, the last one is Nur Amira Syazwani binti Zulhairi.
I will talk about source of the patient for X-ray examination in radiology department. Okay, the source of the patient for X-ray examination in radiology department is patient are typically referred for X-ray examination by healthcare professionals such as physician, surgeons, or in emergency situation. This referral based on the need to investigate or monitor specific health condition, injuries, or symptom using X-ray imaging. Additionally, patients may also be referred for routine screening or follow-up imaging based on their medical history or ongoing treatment. Okay, besides, mostly patients from other departments such as orthopedic, cardiac, or neurosurgical department might need an X-ray examination to help in diagnosis a condition that is performed by the radiologist or radiographer. Okay, these are the departments which needs the X-ray examination, such as orthopedic surgery or orthopedic is the branch of surgery concerned with condition involving the musculoskeletal system. Orthopedic surgeon are both surgical and non-surgical means to treat musculoskeletal trauma, spine disease, sports injuries, degenerative disease, infections, tumor, and congenital disorders. Okay, cardiology is a medical specially dealing with the diagnosis and treatment of the disease and disorders of the heart. And proceed to the next slide, which is the process of X-ray registration of examination. Okay, the X-ray registration process usually begins with the collection of patient information, including name, address, and contact information. In addition, the register will collect basic medical information such as medical history or current health conditions. After that, the patient may be asked to fill out a consent form or get specific instruction before the X-ray examination is performed. This information help create a comprehensive record associated with the X-ray examination. Once patients are collected, they will be given identification label information related to their X-ray examination. This data is the entered into the hospital's information system or auto registration management. After the registration is complete, the patient will be directed to the X-ray examination room, where the process of taking radiological image will be carried out by a radiology technician or a computer medical office. The result of the examination will then be interpreted by a radiologist or related specialist to make a diagnosis. In addition to this, we should ask for the patient LMP, especially women. LMP refer to the first day of the last menstrual period. The primary aim asking the LMP is to confirm the status of pregnancy in women or bearing age capacity. Other than that, the patient food allergy must also be in the registration form. We proceed to the process of X-ray distribution of examination. Okay, once X-ray image are taken, they are stored securely in the medical facilities digital system like PACS to make them easy to find. Each set of image is labeled with specific codes connected to patient information. To protect patient privacy, only authorized medical staff can access this image. Authorized personnel can view the image remotely, facilitating collaborative decision making. The finding from the image are often add to electronic medical record to create a comprehensive patient history. Patient image are retained for an extended period to meet legal requirement and ensure access to historical data in the future. Okay, types of X-ray examination based on type of examination. Okay, X-ray room are very style and can be asked for various examination. Common types include general radiography, fluoroscopy, computed tomography, CT scan, mammography, angiography, portable X-rays, and bone densitometry.
So as you can see here, these are the type of X-ray examination that needs an appointment. But for your information, not all examination needs an appointment, and only some of the examination required to get an appointment. It is practically because the examination can be carried out in a systematic manner. So next, we move on to patient's appointment process. In special examination, patient must understand and follow all the instructions given by radiographer. So, in the process of patient's appointment, the X-ray form will be filled up by the doctor in charge. X-ray staff will give the X-ray form to the radiologist. So then the radiologist will sign the X-ray form and immediately carry out the cases. So after the radiologist will sign the X-ray form, X-ray staff will record the suitable date and time of the examination in the appointment system. Uh, Also, the patient information such as patient name, registration number must be recorded accordingly to the specific modality. And then, lastly, the staff or nurse in charge will prepare all the preparation before the examination. So after then, I'm going to present about rules and responsibility of radiographer during performing X-ray examination. So first of all, the radiographer should practice the breathing pace with the patient before start positioning. The patient must follow all the instructions. Emergency situation occurs such as patient suddenly stop breathing, faint, or vomiting. Also, the examination will be running smoothly and easily in order to get a high quality radiograph. Then, after that, the patient needs to do the correct positioning technique to avoid repeat examination. Us, as a radiographer, must make sure the patient is safe and comfortable. The technique include the positioning of the whole body anatomy in relation to the image receptor or the positioning of the particular body area to facilitate imaging with the use of positioning aids. For instance, immobilization of elbow or knee joint. Also, beware of this patient safety when we want to change the position, such as from anterior posterior to lateral side. Then, other than that, apply the radiation protection also is required to all patients. As you all know, the image in radiography are created by passing an X-ray beams through some section of a patient body. For example, in mammography, the objective is to produce image that provide maximum visualization of breast anatomy and the signs of disease without subjecting the patient to unnecessary radiation. Lastly, remind patient do not move and make sure the patient follow the instruction. As for safety, apply the immobilization device such as sponge, straps, or sandbag to avoid patient movement and to ensure patient feel comfortable. Don't leave the patient alone while she or he inside the X-ray room.
Okay, next is the duties and responsibilities of radiographer after performing an X-ray. There are two type of patients at hospital, which is outpatient and inpatient departments. Therefore, the radiographer have different duties and responsibility for each type of patient. Okay, first is the outpatient. Okay, for outpatient, the radiographer have to make sure the patient's examination has been finished on the radiology computer system. Okay. Next, the radiographer will inform the patient that the examination is finished. Okay. The patient has ability to change to their own clothes and take all their belongings. Okay. As soon as they leave the X-ray rooms, please make sure that the patients know where to go, which is clinic or home.
Okay. While for inpatients, the radiographer must tell the charge nurse that the examination has finished. Okay. While waiting for the charge nurse to arrive, the radiographer must monitor and keep them company. It is because that the contrast medium may cause the patient to feel lightheaded or throw up. Okay. As soon as the charge nurse is arrived, the radiographer have to return the patient folder. Okay, next is the process of dispatch patient after performing an X-ray. Okay, the radiographer responsibilities after performing an X-ray is to review the image. They have to make sure that the image is clearly enough to physicians and medical professionalism to diagnose the patient. Okay. Next is to interpret the image. Radiographer have responsibility to interpret the image but have no right to tell the patient about their condition. Okay. Afterwards is to print or develop image. Okay. The radiographer will print or develop image after make sure that the image is accurate, clear enough, and perfect. And they may print the image through computer printing process. Okay, and the radiographer have to label each of the image and add them to the patient's medical records. Okay. Afterward, the crucial duty of the radiographer is to clean the equipment that may utilize during the process. This conclude the imaging equipment and furniture that patient may utilize.
I'm going to present about the process of X-ray reporting. I will explain the definition of X-ray reporting first. The definition of X-ray reporting is the results of an X-ray imaging process are usually covered in detail in an X-ray report. It contains details about any anomalized wounds or illnesses seen in the scan region, frequently accompanied by interpretations from a radiology specialist or other medical expert who has reviewed the X-ray pictures. There are some specific terminology, phrases, and acronyms that are frequently used in X-ray reports, such as CR, NF, undulation, density, and lucency. Okay, this is a common terms found in an X-ray imaging report. Furthermore, whether it's an X-ray of the belly, hand, or chest, the notes in your X-ray report hold the secret to understanding your scans. An X-ray imaging report may include complex medical jargon or phrases that are unknown to the reader in addition to common terms contained in a report notes. That I will explain the process of X-ray reporting. Process of X-ray reporting have 5 steps, which is image acquisition, radiologist analysis, interpretation, report creation, and communication. Okay, first is image acquisition. A patient will take a pose for taking an X-rays by a radiologic technologist. Second is radiologist analysis. An X-ray image will send to a radiologist who inspects them to identify any problems such as abnormalities or injuries. Thirdly is interpretation. When interpreting the pictures, the radiologist notes any pertinent findings and compares them to normal structures or, if available, earlier scans. Fourth is report creation. The radiologist will generate a detailed report summarizing their observation, including any abnormalities, injuries, or potential diagnosis based on their analysis. Okay, last but not least, for process of X-ray reporting is communication. The referring physician or healthcare provider who ordered the X-ray is then informed of this information. The results aid in directing the patient's subsequent course of care or diagnosis. Okay, next is dispatch X-ray report. Definition of dispatch X-ray report is the process of sending or forwarding the complete X-ray report from the radiologist or medical facility is commonly referred to as a dispatch report. In order to enable speedy decision making, referral, or additional treatment, it can also refer to a true or concise summary of X-ray results that is promptly communicated to or conveyed to a specific recipient, such as a referring physician, medical team, or healthcare provider. There are five process of dispatch of an X-ray report, which is report generation, quality check, electronic transmission, delivery, and accessibility. Okay, first is report generation. Upon completion, the report is often generated electronically by the radiologist. Second is quality check. The report is put through a quality check to make sure it is accurate. There, thirdly is electronic transmission. The medical facility or provider that requested the X-ray receive the completed report electronically. Fourthly is delivery. The report may be sent via secure electronic means such as a hospital information system, or it may be printed and sent to the requesting healthcare provider in person depending on the system in place. Last accessibility. The report is often made available for referring physicians to quickly review in the patient's electronic medical record. Okay, I will describe the hospital information system, or we call it as HIS. What is hospital information system? Hospital information system is the name of the area of health informatics that primarily concentrates on the clinical, administrative, and financial requirements of hospitals. This system gives patients their medical history and current status at the precise moment they need it, which helps healthcare providers better coordinate patient care. Hospital management software (HMS) and hospital management system are other names for hospital information system. Data must be stored securely and access to the data must be restricted under specific conditions by the hospital information system. Okay, I will describe the hospital information system, or we call it as HIS. What is hospital information system? Hospital information system is the name of the area of. What is the radiology information system, or we call it as RIS? A network software system called a radiology information system (RIS) is used to manage medical image and related data. RIS is frequently used in conjunction with PACS and VNS to handle picture, archive, record keeping, and billing. It is particularly helpful for monitoring radiological imaging requests and billing information. Patient scheduling, resource management, reporting, and result distribution are some of the main features of the RIS. RIS also has a several basic functions, which is a patient management, scheduling, patient tracking, result reporting, image tracking, and billing. Each basic function of RIS I will explain. For the patient management, is radiology providers can upload image and reports to electronic health record (EHRs), where authorized radiology staff can download and see them. RIS can follow a patient's full workflow within the radiology department. Secondly is scheduling. Staff members can schedule appointments for both inpatients and outpatients using the RIS. Thirdly is patient tracking. By using a RIS system, healthcare professionals may monitor a patient's whole radiological history from the time of admission until their discharge and sync it with appointments from the past, present, and future. Fourthly is results reporting. A RIS is capable of producing statistical reports for a specific procedure, a group of patients, or a single patient. Number five is image tracking. Radiology providers have historically tracked individual films and the data they are connected with using RIS. However, radiology departments and their RIS PACS systems have found themselves more integrated into the clinical workflow of the entire medical enterprise as electronic health records (EHRs) have become the norm throughout the healthcare industry, and digital pictures and PACS have been extensively embraced. Last but not least, for my part, is billing. RIS system handle electronic payments and automated claims in addition to providing comprehensive financial record keeping. However, these features are increasingly being integrated into the entire EHR systems of medical organizations. There are three elements of hospital information system, which is a core system, business or financial system, communication or networking system, department management system, medical documentation systems, and medical support system. The core system is relates to the necessary daily duties and their operating requirements. Secondly is business or financial system. This covers the management and patient care information system, including the hardware and software needs. Third is communication or networking system. Study examines how consulting physicians schedule their appointments. Number four is department management system. This deal with choices about catastrophe recovery, short and long-term patient care decision, and hospital management. Then is medical documentation system. This deals with legal records, accreditation, and record keeping. Last but not least is medical support system. Clinical and medical patient care procedures carried out in the hospital.
So now I will proceed to explain about PACS system, which is a picture archiving and communication system. Okay, so historically, technology advances in the ever evolving field of the medical imaging, okay, have fundamentally changed the way medical uh, practitioners, okay, practitioners diagnose, okay, and treat patient. Okay, so picture archiving and communication system, which is or we call PACS. Okay, there are key element at core of this change. Okay, so this art of sorry. Okay, the state of the art equipment marks a significant shift from conventional film-based radiology to a digital configuration that improve patient care and streamline healthcare procedures. Okay, so for your information, PACS like the foundation of contemporary radiology that offering a complete answer, okay, so to the problem brought on by the growing volume of medical image. Okay, so it brings in the era of accuracy and cooperation by smoothly combining digital diagnose picture storage, okay, so retrieval and communication. Okay, so as we examine PACS in more detail, we will learn about its main uses. Okay, so such as facilitating image access remotely, maintaining data confidently, and being essential to the workflow optimization of radiology. Right? Okay, so next I will proceed to explain about medical ethics and professionalism in patient care and in radiology department. Okay, so ethics. Okay, so as we studied before, as a field of study, focusing on understanding the right or wrong action in human interaction, right? Okay, so when applied to the medical professions, this framework is known as medical ethics. Okay, so medical ethics is a specialized area that guide healthcare profession in how they should interact with patient. Okay, so it consists moral rules and principle that as a guide, okay, that act as a guide to ensure that practitioners maintain the high level of integrity, right, and treats and those under their care with compassion. Okay, so this field addresses various issues such as respecting patient autonomy. As radiographer is must keeping information confidential because we not deserve to diagnose the patient. Okay, so we also need to obtain informed consent. Okay, and the last one is finding the right balance between doing good and avoiding harm in patient care. Okay, so that's why medical ethics is crucial for building and preversing. I'm sorry. Um, okay, medical ethics is crucial for building and preserving trust and well-being among individual seeking medical help. Okay. Okay, so the realm of medical ethics and professionalism, radiographer adhere to set apa tu principle that shape their practice. Okay, so they are committed to providing services without discrimination. Right, so ensuring equal care regardless of factor like age, sex, race, religion, status, and disease. Alright.
And next, I'm going to present about the flowchart of the X-ray examination, or also the process of the X-ray examination. First of all, we have registration. The purpose of registration is to learn the basic steps which must be taken by front office staff upon the arrival of a patient at any of our UNT head clinics in order to check that patient in for their scheduled appointment. Then secondly, preparation of the X-ray. Patient preparation can differ between departments based on the type of examination being conducted. Regardless of the specific procedure, both physical and psychological preparation are essential for a successful examination. What does it mean by physical preparation? Physical preparation is relatively straightforward, often involving instructing the patient to remove their clothes and all jewelry. And then psychological preparation is involving establishing a positive report with the patient. These include providing clear and reassuring information about the upcoming procedure. Any concerns or fears expressed by the patient should be addressed promptly and empathically. Overall, a good relationship with the patient is crucial to ensure their comfort and cooperation during the examination. And lastly, ensuring patient identity is crucial step in examination process. It involves asking the patient for identification details and cross-verifying them with information on request or X-ray form, including their name, age, date of birth, identity card, and registration number. And then the third one we have positioning of patient. When it comes to positioning the patient, there are a few factors to consider such as alignment, immobilization, comfort of patient shading, and communication.
Okay, next is image acquisition. Okay, image acquisition is a act of obtaining a picture from an external source for additional process. Okay. A major advantage of digital radiography is extremely high image quality. Okay, in order to diagnose disease, direct medical interventions like surgical planning or conduct research will use an exploration of 3D image datasets of the human body acquired from a CT scan and MRI. Okay, final image are stored digitally on storage media for viewing on a computer. Okay, next is image review. Why we need to review the image? It is because to get a high quality of image, because it can influence the diagnostic accuracy and subsequent clinical management of patient. Getting an image is the first stage of the workflow because without it, no procedure can begin. The features that we need when reviewing an image is patient identifications, which have date and time image was taken, ensure laterally is correct, and image comparing. Next is the image must be clear, and lastly, the image should be acquired in anatomic position when possible. Okay, last is the patient report. Okay, the following is the five section that we need to include in the patient report, which is an abstract, an introduction and objective that contain a literature review, a description of the case,
a discussion that include a detailed explanation about the review, a summary of the case, and lastly is a conclusion.